Autism, also known as Autism Spectrum Disorder or ASD, is a complex developmental disability that affects millions of families worldwide. It impacts social skills, communication, and emotional connections. Imagine a child who suddenly withdraws, losing the ability to interact and communicate. Autism is not just a single condition but a spectrum, meaning symptoms and severity vary widely. Typically noticed in young children, autism occurs 4 to 5 times more often in boys than girls. Families often face immense challenges as both the child's ability to communicate and the family's ability to connect are disrupted. The journey begins with understanding what autism really is and how it affects those touched by it. The term spectrum in autism spectrum disorder refers to the wide range of symptoms, skills, and severity. Neuroimaging shows that autistic brains process information differently, leading to unique strengths and weaknesses. Some children may have mild symptoms, while others face severe challenges. Autism is not a disease but a disorder, encompassing various conditions like autistic disorder, childhood disintegrative disorder, pervasive developmental disorder not otherwise specified, and Asperger syndrome. Recognizing the diversity within the spectrum is crucial for understanding and supporting individuals with autism. Autism presents a variety of symptoms, some of which may also appear in non-autistic children. These include avoiding physical contact, impaired nonverbal behaviors like eye contact and gestures, limited interaction with peers, preference for solitude, and difficulty initiating or sustaining conversations. Children may lack play or make-believe activities, show obsessive attachment to objects, and struggle with executive functioning such as working memory and self-control. Resistance to change, narrow interests, poor motor skills, delayed speech, and repetitive speaking are also common. Understanding these symptoms helps in early identification and support. Restricted and repetitive behaviors are hallmark features of autism. Children may engage in repetitive body movements like rocking, flapping, spinning, or running back and forth. Stimming, such as flapping hands or snapping fingers, is often used to calm or express feelings. Repetitive motions with objects, organizing toys in specific ways, and avoiding make-believe play are common. Pica, the tendency to eat non-food items, and physical issues like poor coordination and hand control also appear. Sensory sensitivities to sounds, lights, textures, tastes, and odors can lead to agitation or distress. Myelin is an insulating layer around nerves, crucial for fast and efficient transmission of electrical impulses. Damage to myelin slows down nerve signals and can lead to neurological diseases. In autism, myelin plays a significant role. Inflammation, often triggered by food proteins, can damage myelin, leading to sensory issues and muscle weakness. Restoration of myelin is possible through diet and supplementation, such as high EPA DHA fish oil and a healthy high-fat diet. Vitamin B12 deficiency, especially during pregnancy, is linked to poor myelination and developmental delays. Early symptoms of autism in babies can be subtle and sometimes mistaken for signs of a well-behaved child. These include lack of eye contact, no response to parents' voice, absence of babbling or pointing by 1 year, not responding to their name, and not smiling or laughing at others' behavior. Babies may not grasp or reach for objects, fail to turn their head toward sounds, and lack gestures like waving or shaking their head. Some children may regress or lose language skills as they grow older. These signs are not definitive, but warrant further assessment. All autistic individuals share certain core symptoms: significant difficulties in social communication, repetitive behaviors, intense focus on specific interests, unusual responses to sensory input, and a compromised immune system. Many also have a history of infections and inflammation, particularly in the first years of life. Ear and chest infections are common, often leading to frequent antibiotic use. These recurring health issues highlight the importance of understanding underlying causes and exploring ways to address them. Research increasingly supports a strong relationship between gut health and neuropsychiatric disorders like autism and ADHD. Bowel issues are common in autistic children, and the digestive tract plays a pivotal role in recovery. The gut and brain, both originating from the same tissue during fetal development, communicate extensively. Over 100 million brain cells reside in the gut, and 70–80% of immune tissue is found there. Damaged intestinal villi, often due to immune reactions to gluten or casein, impair nutrient absorption and contribute to symptoms. Vagus nerve connects the brainstem to the body, linking the neck, heart, lungs, abdomen, and gut to the brain. It is a critical pathway for mood, immune response, digestion, and heart rate regulation. The vagus nerve supplies fibers to various organs and plays a key role in the parasympathetic nervous system, which acts as the body's brakes. An imbalance in this system can lead to dysregulated immune function, making recovery from stress or illness more difficult. Strengthening vagus response is linked to better health outcomes. Genetics play a significant role in autism, particularly through genes like HLA-DQ2 and DQ8. These genes contribute to heightened immune sensitivity to gluten and are common in individuals with celiac disease. Antigen-presenting cells use these proteins to display foreign fragments for immune system review. When gluten is consumed, it binds strongly to DQ2 and DQ8, triggering immune responses that damage intestinal cells. Other genetic predispositions, such as overproduction of immune stimulants, further prime the immune system to attack the gut. Diet is a cornerstone of autism treatment, healing the digestive tract, stopping leaks, establishing normal gut flora, and supporting vagal tone are essential. A strict gluten-free, casein-free, and processed sugar-free meal plan is recommended. Dr. Andrew Wakefield's research highlighted inflammatory bowel disease in autistic children, linking digestive abnormalities to autism symptoms. Avoiding gluten and casein relieves symptoms, promotes gut healing, and lays the foundation for recovery. Most autistic individuals who follow this diet see significant improvements within 2 years. Individuals with autism often have abnormally high levels of antibodies, including anti-gliadin, anti-endomysium, and anti-tissue transglutaminase. When gluten is consumed, the immune system treats it as a foreign invader, producing elevated antibodies that damage the villi in the intestines. This leads to malnutrition, regardless of food intake. Immunoglobulins like IgG and IgA are key players in this response, and blood tests can detect these antibodies. Avoiding gluten is crucial to prevent ongoing immune reactions and intestinal damage. Gluteomorphins, peptides from partially digested gluten, bind to opiate receptors in the brain, similar to morphine. This opioid theory of autism explains why children with autism may have abnormal peptides in their urine, affecting brain function. Dairy protein also contains opiate molecules, which attach to the same receptors. These reactions can impair sensory processing, speech development, and lead to addictive behaviors. The blood-brain barrier, which protects the brain, can be compromised, allowing these peptides to disrupt normal brain activity. Diagnosing autism can be challenging. Professionals assess 8 developmental areas: cognition, language, executive functioning, motor skills, play, adaptive skills, social interaction, and academic abilities. Genetic testing for HLA-DQ gene variants and blood tests for IgG antibody inflammation are available. These tests help identify food sensitivities and immune responses that may contribute to autism symptoms. Understanding the interconnectedness of these developmental areas is vital for accurate diagnosis and effective intervention. Healing the gut is a 4-step process. Remove foods and factors that damage the gut, replace with healing foods, repair with supplements like Barleylife and just carrots for vitamin A, and rebalance with probiotics such as Florafood. A gluten-free, casein-free diet remains the only effective, medically proven treatment for autism. Being picky and prepared with safe snacks is essential. Liquid nutrition, easy-to-digest foods, and supplements support gut healing and reduce inflammation. Recovery is possible when gut health is restored. Healthy microbiome is essential for immune development and metabolic regulation. Dysbiosis, or imbalance of gut microbes, is linked to autism. Antibiotics, especially frequent or long-term use, can wipe out beneficial bacteria, leading to digestive disorders and compromised immunity. Gut flora is inherited from the mother, and compromised flora can be passed down through generations. Breastfeeding helps establish normal gut flora, but toxins in the mother's blood can also be transferred. Maintaining a balanced microbiome is crucial for overall health and autism management. Supplements like Florafood, Barleylife, cocoa leaf greens, and CalciAIM play a role in gut repair and detoxification. Florafood contains probiotics that balance intestinal pH, manufacture vitamins, and enhance immune function. Herbal Fiber Blend helps cleanse the digestive system. Sulforaphane in cocoa leaf greens activates detox pathways, reducing inflammation and increasing antioxidant protection. CalciAIM provides essential calcium and vitamins. These supplements support gut health, detoxification, and myelin repair, contributing to improved outcomes for autistic individuals. Environmental factors like glyphosate, a common herbicide, are increasingly linked to autism risk. Glyphosate disrupts gut bacteria, favoring harmful species and impairing mitochondrial function. Studies show that children with high glyphosate exposure have elevated urinary levels and behavioral changes. Choosing non-GMO foods and avoiding glyphosate is recommended. Barleylife contains antioxidants that help break down glyphosate and heavy metals, supporting detoxification and gut health. Good news is that autistic children are born with normal brains, and recovery is possible. Once gut flora is restored, many food intolerances disappear, and the body's detoxification systems can function properly. Some children may need active detoxification with juices and supplements. Therapeutic vegetable juices, particularly green juices like Barleylife, support gut healing and chelation of heavy metals. With the right diet, supplements, and care, significant improvements can be achieved, offering hope to families affected by autism.
Welcome. Today I'll show you exactly how to join Beautique and make your first purchase. I'll guide you through every step, from choosing your account type to completing your order. Start by opening the main menu to explore our mission and the products section. You can join as a customer for rewards or as a member to start your own business. The sign-up form is straightforward. Just enter your contact details and shipping information. Members will also provide a few extra details to set up their independent distributorship. Once registered, browse our full catalog and select the high-quality products you'd like to try. Once logged in, simply find your favorite products, add them to your cart, and click Checkout Now to complete your order. You're now ready to start your journey with Beautique. We're excited to have you with us.